Everyone, this is your third and final coding module. Today we'll be focusing on preventative care coding. We will begin by discussing the basics of preventative care coding, followed by adult wellness, women's wellness, men's wellness, and then pediatric preventative care. We will finish this module with 3 case studies. First, let's review the basics. Step is to determine if the patient is new or established. Next, during your exam, if you note an abnormality or address a pre-existing condition, then you would code for both the preventative care plus the code for the appropriate office visit. This means you would use the annual wellness CPT code plus your 99213 code. Now what you need to educate your patient on is the fact that adding this problem visit will then add a copay to their preventative visit. The other option is to request that the patient return in a week to address the problem. ICD-10 codes for preventative care are fairly straightforward, but preventative coding is still complicated. To make sure that the insurance company pays for the care, you must properly code the combination of CPT codes and ICD-10 codes. Insurance will cover for a wellness visit 1 year and 1 day after the last visit. These are all aspects of the general wellness visit. Screening tools including depression, vital signs, height, weight, BMI, vaccines, advanced directives, updating history, updating medications, personal health advice, risk factor education, anticipatory guidance, labs, and other diagnostics. A wellness visit is not a problem visit. However, CPT instructs if an abnormality is encountered or a pre-existing problem is addressed in the process of performing this preventative medicine evaluation and management service, and if the problem or abnormality is significant enough to require additional work to perform the key components of a problem-oriented evaluation management service, then the appropriate office outpatient code 99201 through 99215 should also be reported. Coding for vaccines. When coding for vaccinations, you simply report the ICD-10 code Z23. Z23 is the ICD-10 code for encounter for immunization. This covers every vaccine, no matter how many vaccines were given or what the vaccine was. Now you also have to assign the CPT code for giving the vaccine plus the specific vaccine that you gave. Age specific or non-age specific. These are the codes for non-age specific immunization coding. As you can see, 90471 covers your percutaneous, intradermal, sub-Q, or IM injections, and then 90472 is each additional vaccine you gave. 90473 covers intranasal or oral, and then 90474 is each additional of those intranasal or oral vaccines. This slide focuses on pediatric immunizations or age-specific immunization coding. So you'll see here it says immunization administration through 18 years of age via any route by qualified healthcare professional, first or only component of each vaccine. Component refers to all antigens in a vaccine that prevent diseases caused by one organism. Combination vaccines contain multiple components. Report a 90460 for the first or only component in a single vaccine. You can chart 90460 multiple times per encounter. 90461 is an add-on only to 90460 if there are more than one component to the vaccine. You can only use these codes if the patient is 18 or younger and when counseling about the vaccine has been given. Sometimes immunizations are not given during routine preventative services. Due to tracking purposes and quality measures, it is important to report non-administered vaccines. Here would be the ICD-10 codes for the reason that the vaccine was not given. This information will be provided to you later in the module. Remember, when you code a vaccine, you have to code the immunization code plus the vaccine code plus the encounter for immunization ICD-10 code. Now that we reviewed some general guidelines for preventative care, let's review an adult preventative care visit. For an annual visit, you really should not have a chief complaint or HPI. You can briefly address the patient's current problems, but for additional interventions, you would need to add on a problem visit CPT code for insurance to pay for this. This would mean the patient would have to have a copay. So in an adult preventative care visit, you update a history, evaluate based on age and history, you do a physical exam, advice, screening, labs, diagnostics. Additional screenings would include an obesity screening, STI screening and counseling, depression screen, cholesterol screen, lung cancer, skin cancer, and a discussion about vision and dental exams. There are several labs that are considered always diagnostic in the general adult population that will not be covered in a preventative visit. These include a CBC, a CMP, and a urinalysis. National guidelines have recently changed, stating that a PSA should only be used as a diagnostic tool if there's a problem. It's no longer considered a screening. These are the recommended vaccines for adults, including the ages at which they are recommended. During the adult wellness visit, we need to screen and provide counseling as well as anticipatory guidance on aging. So we should screen for depression, obesity, tobacco, alcohol, substance abuse, pregnancy. We should screen for fall risk, injury, domestic violence, seatbelt use. And we need to review the medications, and then we need to discuss advanced directives with each patient. You should not bill additionally for counseling during a routine wellness visit, as this is considered part of the preventative care visit. However, during an acute visit, you can also use preventative coding to counsel patients. For example, if a patient comes in for an ankle sprain and you address tobacco cessation, then you could code for a preventative medicine code. Now remember that these codes include all of the following in them, so do not bill separately: history, exam, counseling, guidance, risk reduction, interventions. You can bill for immunizations as well as appropriate screening tools, but remember, insurance will not pay for it as part of a preventative care visit if the diagnostic is not considered part of the routine screening. Now let's review women's preventative care. Since over half of all pregnancies in the United States are unplanned, preconception counseling should occur at each wellness visit. Make sure to update vaccines as needed for women who plan to become pregnant. This includes Hep B, MMR, influenza, and Tdap. The idea of preconception care in the annual wellness visit is to address issues that are concerning in case of pregnancy. These are typically issues that should be addressed in an annual exam anyway, such as potential risk for mother and fetus, education and risk and counseling options for these risks, and initiating interventions to assist in care such as vaccinations and folic acid. Other screening tools to note in women are the BRCA risk assessment and genetic counseling if at high risk. Intimate partner violence should be assessed annually. Contraceptive counseling is part of the Well Woman exam. However, it is important to note that some insurance companies will not cover contraceptive counseling due to religious beliefs. During Well Woman visits, women of childbearing age should be counseled on folic acid supplementation. Cholesterol should be screened in women 20 to 45 who are at increased risk of CHD, and women who are 45 plus should be screened if they are at risk of CHD. Women aged 20 years and older who are not at risk for coronary heart disease should not be screened. This is considered a C category in the USPSTF clinical recommendations for cholesterol screening. According to USPSTF, anemia screenings are only recommended as routine screening in asymptomatic pregnant women, but not women who are not pregnant. This would be coded under the Z130, encounter for screening for diseases of the blood and blood-forming organs and certain disorders involving the immune mechanism. Remember how it was previously mentioned that a urinalysis was not considered a screening tool? Well, in pregnant women and all women of childbearing age, a urinalysis is considered a screening tool if coded with a preventative visit code. This is where preventative care gets confusing, as some codes are not considered screening unless you are a woman of childbearing age or pregnant. These are the preventative codes for Well Woman exams. Remember that insurance might not pay for certain screenings past certain ages, so it is up to you as a provider to determine how to code STI screenings of women over 25. These codes are linked with or without a pap smear. During routine Well Woman exams, you should screen all sexually active women under the age of 25 for STIs annually, and women older than 25 should be screened if they are at risk, such as a new partner, multiple partners, or other risky health behaviors. These are the ICD-10 codes for contraceptive management. This list is not comprehensive and does not include long-acting reversible contraceptives. You will be given the comprehensive list later in Module 3. You can code these ICD-10 codes during your preventative care visit, as contraceptive counseling is considered to be part of the wellness visit. You follow the same CPT coding guidelines for any general adult wellness exam. Now let's discuss men's preventative care. These are the screening recommendations for men over the age of 18. We are no longer screening for prostate cancer routinely, as the PSA can often show false results. Men should now only be tested if there is an issue or problem occurring, as this is now considered a diagnostic instead of a screening tool. Other screens should be cholesterol, abdominal aortic aneurysm, and that's only if they have smoked and they are between the ages of 65 and 75. Now let's discuss pediatric preventative care. These wellness visits can occur at more frequent intervals due to the rapid growth in children, especially in the first few years of life, so you should follow the appropriate guidelines. Pediatric preventative care includes screening tools for depression and autism, vital signs, height, weight, BMI, head circumference, vaccines, history, medications, risk factors, definitely anticipatory guidance, and some labs. This is the Bright Futures Screening and Preventative Care Guidelines for Pediatrics. You'll be given the full form later in Module 3 to assist in your pediatric care. This is a comprehensive list that explains what to screen and examine for peds in their preventative care visits. This is the list of the pediatric immunizations. These are the CPT and ICD-10 codes to follow when billing for a pediatric wellness visit. Notice that the codes are determined by the age of the patient. So a 99381 is the CPT code for an infant younger than 1, but then a 99384 is for an adolescent between 12 and 17. You also have Z00.110, which is for newborns under 8 days old, but then the Z00121 and Z00129 are for kids 1 through 17. As an adult health, remember that sometimes immunizations are not given for certain reasons, so it is important to code for the reason that the patient is not being vaccinated, especially in the pediatric population. While a sports physical is considered a preventative service, a provider cannot bill one of the preventative services CPT codes for a sports physical because they are not considered comprehensive. That being said, an insurance company might not pay for a sports physical under a 99212 to 99215 because these are often considered problem visits. The best suggestion would be to perform sports physicals during the annual wellness visit in which a comprehensive exam is performed. Now we will test your knowledge with several case studies. You have a 21-year-old female who presents for her well woman exam. She is currently on low estrin FE without complaints. Her last menstrual period was 6 years ago when she started her oral contraceptive. She is satisfied with this contraceptive method and has no complaints. She's a G0, P0 and reports one male partner. No complaints. She's allergic to penicillin. She's on low estrin FE and a multivitamin. Menarche began at 12. No significant past medical history. She has a history of migraines in her family, lung cancer, heart attack, diabetes, hypertension, and cyst. She denies tobacco, drug use, and reports 2 to 3 drinks of alcohol 2 to 3 days per week. She denies a history of STIs or PID. She has no desire for pregnancy right now. She gets about 1 hour of cardio 3 days per week. She denies breast masses, lesions, rashes, or discharge, denies pelvic pain, bleeding, vaginal discharge, dryness, lesions, burning, and denies concerns of sexual dysfunction. She denies dysuria, hematuria, nocturia, flank pain or retention. She denies blood and stool, constipation, pain with defecation, diarrhea, nausea, or vomiting, and she denies thoughts of suicide. She is underweight. Her vital signs are. She's a white female who appears her stated age and is in no acute distress. Her lungs are clear to auscultation. She has a regular rate and rhythm. She has no masses, lesions, or tenderness or discharge noted on bilateral breast. No CVA tenderness. No concerns with the rest of her exam. So what laboratory data and other screening methods do you need for this visit? And what counseling would you need for this visit? So you need to do a urinalysis since she is a woman of reproductive age. You need to check her blood pressure, perform her first pap smear, perform a chlamydia gonorrhea screen since she's under 25. You need to discuss and offer HIV screening, and you need to screen for partner violence. Remember that the general adult preventative care, a urinalysis is not a screening tool, but because she is a female of childbearing age, she would be screened with a urinalysis. What would your ICD-10 diagnosis codes be for this visit? What would your CPT codes be? So this is a encounter for gynecological examination. That includes the pap smear in there. Encounter for screening for sexual STIs. Encounter for surveillance of oral contraceptives, and then you can screen for her or code for her BMI. This would be considered a preventative care visit, and then you'd bill for the urinalysis as well. Everything else the lab would bill for because they are doing the pap smear, they are doing the labs on the pap smear, they're doing the labs on the STI testing. So you have a 54-year-old male who presents with complaints of heartburn for 2 weeks. He began experiencing the heartburn 2 weeks ago and it is constant, 3 out of 10 pain in his mid-abdomen. The burning goes up to his neck. He reports a sour taste in his mouth, is burping, and sleeps on 3 pillows. He says he's in constant pain but gets worse after he eats spicy food, gets better with dairy, denies increased pain after eating. He reports that he takes Tums and it only helps for a few minutes. He does have a history of GERD and reports that it got better after he lost 30 pounds, but it's come back. He reports that he's a 2-pack per day smoker and started when he was 12 years old. He has no known drug allergies. He's currently on lisinopril and pravastatin. He has a history of hypertension, hyperlipidemia, GERD, and no surgical history. He denies alcohol, drug use, and he has the 2-pack per day tobacco use. No headaches, fatigue, weight loss, night sweats, no edema, palpitations, or syncope, no shortness of breath or wheezing. He has heartburn, no blood in stool, constipation, diarrhea, nausea, vomiting, or abdominal pain. He is considered obese. His vital signs are stable. Appears to be older than his stated age. He's in no acute distress. His lungs are clear. His heart rate is regular. He has no murmurs. He has bowel sounds active and present in all 4 quadrants. No bruise, no splenomegaly, hepatomegaly, no tenderness, no CVA tenderness, and skin is. The patient is diagnosed with GERD and given omeprazole for his symptoms. What counseling would benefit this patient to reduce his symptoms? What are the ICD-10 and CPT codes for this office visit? The symptoms of GERD can be triggered by tobacco use as well as obesity. You need to counsel this patient on tobacco cessation as well as dietary changes and weight loss. But remember, in order to code for them, you must accurately and specifically document what you counseled on as well as the time you spent in order to bill for counseling. Because this is just a case study, we're going to assume some things about this diagnosis and assume it's GERD. Notice the CPT code is for a problem visit. This exercise is to show you how preventative care can be coded in a problem visit. This patient needs to be educated about tobacco cessation in order to help most of his problems. Notice that only tobacco use cessation is coded on this. You need to educate the patient on tobacco cessation, document this appropriately, as well as document the time needed. You should also suggest that this patient return to discuss diet and exercise for weight loss. However, given a 15-minute office visit slot with this patient, it's difficult to provide education and counseling on multiple things. You have an 11-year-old female patient who presents with a need for a sports physical and an earache in her left ear. She says that she's going to start playing volleyball this year and that she had pain in her left ear beginning 3 days ago. She reports the pain as 6 out of 10, denies runny nose, postnasal drainage, cough, sore throat, sinus pressure, wheezing, headache, fever, chills, or fatigue. Mother reports that she's given her Tylenol and Zyrtec and she has no known drug allergies. She's currently on Zyrtec. She has a history of tympanostomy tubes, but nothing else. No alcohol, tobacco, or drugs. Family is all alive and well. No siblings. Her last dental exam was 4 months ago, has not begun menarche, and she denies being sexually active. So she denies fever, fatigue, weight loss, chills, or headache, reports left ear pain, no vision changes, hearing loss, runny nose, no swelling in her feet, no feeling like her heart skips a beat, no shortness of breath or wheezing, no nausea, vomiting, constipation, diarrhea, or blood and stool, no flank pain, no burning when she pees, she doesn't get up at night to pee, no rashes or lesions, no muscle aches, no joint pain, no joint swelling, no thoughts to harm herself or others. So she is at the healthy weight category. She's at the 70th percentile for her BMI. Her vital signs look good, except for her temperature is slightly elevated. Female who appears her acute stated age and has no acute distress. Vision's 20/20. She passed her whisper test. Her left tympanic membrane is bulging and erythematous with a moderate effusion. Her right tympanic membrane is clear and pearly gray. Nasal mucosa is pink. Oral mucosa is pink. Regular rate and rhythm, no murmurs, no edema. Lungs are clear to auscultation. Bowel sounds are present and active, no tenderness, no masses, no lesions. No flank pain noted. Full range of motion in upper and lower extremities. Spine is without lateral curve. She's alert and oriented. She's able to do the duck walk, and she has Tanner stage 2. For anemia, dyslipidemia, ask about sexual interactions or exposure to STIs, provide anticipatory guidance about menarche. The immunizations an 11-year-old female would need are the Tdap, meningococcal, and HPV. Often you'll have patients say, oh, by the way, during a routine wellness exam, and unless the problem requires additional workup, then you do not need to code for this. Since you would have looked in her ears anyways, this instance did not require additional work, so you would code for the wellness visit plus the diagnosis of the acute condition. Since there's no work, you do not need to add an additional CPT code for this. During the 11-year-old visit, the patient needs screened for anemia and lipoid disorders. She also needs vaccines. Since she's at her annual wellness visit, we do not have an additional code for sports physicals, so this would just be considered under the wellness diagnosis. So a normal encounter for immunization, the acute otitis media, the preventative visit, the Tdap coding, the meningococcal coding, and the HPV coding, and the venipuncture for her blood work. And that is the conclusion of Module 3. I hope you enjoyed it and learned how to effectively code for preventative care visits.